Welcome to Local Gov Strategy TV. Today I've got with me Kevin Lavery, who is the Chief Executive of Cornwall Council. Welcome, Kevin.
Hi, John.
What challenges is Cornwall facing at the moment?
Well, I think as a new unitary, we had the challenge of bringing the 7 organisations together. We've got major economic challenges because we have the lowest GDP in England, but actually the opportunity of one of the highest growth rates. We've had the normal challenge that local government faces as a whole of government grant cuts, but because we are a poor area and dependent on Whitehall grants, we've suffered more than most. But we also had significant service challenges from the previous 7 councils.
So there's a number of things that could be viewed as real negatives. How are you changing those into positives?
Well, I think the key thing for me is you've got a crisis. In a crisis, you have opportunities. You've got to make sure you use that opportunity. So we're doing all the normal things you'd expect. We have a little strapline: fix, prepare, transform. So let's do it sequentially in the right way. Let's fix the basics. So we've been sorting out our service failure and putting our finances in a sensible place. And then we've been preparing the organisation with an extensive training and development programme, new IT systems, etc. And now we're embarking on the exciting phase, which is about transforming Cornwall Council, but more importantly, Cornwall. And we've got a major economic development and housing investment programme. We're seeing significant growth across the county and lots of new employment and jobs, which is good for Cornwall in the long term.
So could you give an example of an initiative that you're taking that's having a real impact on your citizens?
We've got a bundle of 3 initiatives around young people. The first is we've restored the government abolished the education maintenance allowance. That was a major concern for us in Cornwall. That's for 16 to 19-year-olds. So we've introduced the Cornish bursary to provide support for learners from poor backgrounds to encourage them to go to college. We're about to launch a scholarship programme so that 300 students per annum from middle income backgrounds will be provided with financial support to go to university anywhere in the world, and when they graduate they'll be offered a Unlocking Cornish Potential placement for a year in a Cornish business or public sector organisation. And alongside that we're launching a major apprenticeship programme for apprenticeships across Cornwall Council, 200 per year. So I guess the key message is there's hope for young people in Cornwall in these difficult times when we're seeing record graduate unemployment.
One of the key areas at the moment is healthcare, of course, and there's the opportunity for any authority now with the movement of responsibility for public health to local authorities. There's an opportunity to integrate social care and healthcare to a much greater degree than ever before. What are you doing in Cornwall?
We've got a whole bunch of initiatives in that area. We see it as absolutely critical to dealing with the financial pressure on both health and social care going forward, but also the right thing to do for the people who use the services. So we've got a number of things. The first thing is we're pushing an integration agenda between the community health, social enterprise and the council's adult care function. So for example, we now have 6 joined up one-stop shops for health and care across the council area. The second thing is we're doing bringing the commissioning for children's care, adult care and the clinical commissioning group together as one operation. So we're working on that with the new Cornwall commissioning group. Third area is around bringing support services together. So we have a single back office for the 3 health providers, the Cornwall commissioning group and Cornwall Council. And the final area is around telecare, telehealth and telemedicine. For various reasons we've got national pilots in Cornwall for all of those. We also have the biggest super fast broadband rollout in Europe underway now. So we've got all the right ingredients to be the best place in the UK for telehealth services, and we intend to achieve that.
And how are the staff responding to all these changes? Are they resisting it or are they embracing it?
I think we had some really difficult early days when the new council came into being. Not least we had a ballot of the workforce to take £20 million out of the pay bill, which meant reducing terms and conditions, removing increments, and they were tough times. But the staff voted in favour to do it. There was a realism. They wanted to protect jobs rather than, if you like, and in return, in sacrifice, to have a reduction in pay. But I think where we are now is having stabilised the finances and having the ability now to invest. They're seeing the fruits of those difficult decisions, and I think there's growing respect And that's not just my opinion. We had a very strong Local Government Association peer review led by Barry Quirk, which came in and confirmed that view.